Postoperative pain management is a critical aspect of recovery for animals after surgery. What are the key factors to consider when developing a postoperative pain management plan for a dog undergoing abdominal surgery? Provide a detailed explanation of the types of analgesic options available, their administration routes, and the role of nursing staff in assessing pain levels. Include relevant guidelines and laws regarding pain management in animals. Answer: the key factors to consider include the severity of the surgery, the animal's breed, age, and general health. For abdominal surgery, multimodal pain management is recommended, combining different types of analgesics for better efficacy. Options include opioids, e.g., morphine or fentanyl, NSAIDs, e.g., carprofen, and local anesthetics, e.g., lidocaine or bupivacaine for regional nerve blocks. Opioids are typically administered intravenously or subcutaneously in the immediate postoperative period, while NSAIDs can be given orally or via injection to control inflammation and pain. Nurses should regularly assess pain using validated scoring systems such as the Glasgow Composite Pain Scale and report findings to the veterinary surgeon. Pain relief should be adjusted according to the animal's response. According to the Veterinary Surgeons Act 1966 and the Animal Welfare Act 2006, veterinarians and nurses are legally responsible for ensuring animals' pain is managed appropriately. The use of analgesics must be in line with guidelines set by the Royal College of Veterinary Surgeons (REVS) and must comply with prescription and administration protocols. Mr. Thompson is handling an aggressive cat for a routine checkup. The cat hisses and tries to scratch him. What steps should Mr. Thompson take to safely handle the animal and reduce stress, ensuring both his safety and the cat's well-being? What guidelines should he follow to prevent injury and anxiety in the kitty during the handling process? Answer: Mr. Thompson should prioritize his safety and the cat's well-being by using proper restraint techniques. To reduce aggression and stress, he should first assess the cat's body language to understand its fear or aggression triggers. Ensuring the environment is quiet and calm will help reduce anxiety. Using a towel or cat blanket to gently wrap the cat can minimize risk, as it provides a secure hold without excessive pressure. If the cat is showing signs of aggression, such as hissing, Mr. Thompson should avoid direct eye contact and speak softly to avoid escalating the situation. A cat muzzle or soft collar may be used if necessary. He should also ensure that the cat is supported in a position where it cannot fall or injure itself. The RCVS guidelines on handling and restraining animals emphasize the need to minimize stress and pain during veterinary procedures. The Animal Welfare Act 2006 stresses that animals must not be subjected to unnecessary suffering, which includes during handling and restraint. Mr. Thompson should also follow the RCVS Code of Professional Conduct, which advises using techniques that ensure the least amount of physical and psychological distress to the animal. When caring for a deep laceration on a dog's hind leg, what is the recommended sequence of actions for cleaning, dressing, and monitoring the wound? Discuss the rationale behind each step, the types of dressings used, and the legal considerations regarding infection control and wound care. Answer: the sequence of actions for wound care is as follows. Initial assessment. The wound should be assessed for size, depth, and contamination. Any foreign material should be removed. Cleaning. The wound should be cleaned with a mild antiseptic solution such as saline or chlorhexidine. It is essential to avoid harsh antiseptics like hydrogen peroxide, as they can damage healthy tissue. Debridement. Any necrotic tissue should be carefully debrided to promote healing. This can be done surgically or chemically under veterinary supervision. Dressing. The wound should be dressed with a sterile, non-adherent dressing to prevent infection and facilitate the healing process. The choice of dressing depends on the type of wound, e.g. hydrocolloid dressings for moisture retention or gauze for more absorbent needs. Bandaging. The dressing should be secured with an elastic bandage or cohesive dressing to keep it in place, but care must be taken to avoid constriction of blood flow. The dressing should be changed regularly, at least once a day, or more frequently if it becomes wet or soiled. Nurses should also monitor for signs of infection such as increased redness, swelling, or discharge. The Veterinary Surgeons Act 1966 requires that all treatments, including wound care, be administered under the guidance of a veterinary surgeon. The Animal Welfare Act 2006 mandates that wounds are managed to prevent unnecessary pain and suffering, and the guidelines for infection control set by the RCVS should be followed. What are the key components of a hospital sanitation protocol that ensures a sterile environment and reduces the risk of cross-contamination between animals? Discuss the roles of veterinary nurses in maintaining hospital hygiene, including cleaning procedures and the use of disinfectants. Provide relevant laws and guidelines regarding hygiene practices. Answer: a hospital sanitation protocol should include disinfection of surfaces, All surfaces, including cages, floors, and examination tables, should be cleaned and disinfected using veterinary-approved disinfectants. Commonly used disinfectants include quaternary ammonium compounds and hypochlorite solutions. Sterilization of equipment. Surgical instruments, syringes, and needles should be sterilized in autoclaves or using appropriate methods like chemical sterilants. Waste disposal. Contaminated waste, including used dressings, syringes, and animal waste, should be disposed of in designated biohazard containers. These should be sealed and disposed of according to local regulations. Personal hygiene. Veterinary nurses must follow hand hygiene protocols, including washing hands with soap and water and wearing personal protective equipment, PPE, like gloves, masks, and aprons. The RCVS Code of Professional Conduct stresses the importance of cleanliness and infection control, and the Health and Safety at Work Act 1974 requires employers to maintain a safe working environment, which includes infection control measures. 3-year-old cat has been admitted with signs of lethargy, poor appetite, and mild dehydration. What is the approach for monitoring the cat's health, identifying possible underlying conditions, and reporting these findings? Discuss the role of veterinary nurses in ongoing observation and care and the guidelines for recording and reporting changes in an animal's condition. Answer: the initial approach should involve a thorough history and physical examination to assess hydration status, temperature, heart rate, and respiratory rate. Blood tests, such as a complete blood count (CBC) and serum biochemistry, should be ordered to identify any underlying systemic conditions, such as infection or organ dysfunction. The veterinary nurse should monitor the cat's hydration by assessing skin turgor and mucous membranes, provide IV fluids as prescribed by the veterinarian, and offer small, frequent meals if the cat is willing to eat. Regular checks for signs of worsening lethargy or new symptoms should be conducted. Nurses are responsible for maintaining detailed records of the animal's condition, treatment plan, and any changes in behavior or symptoms. According to the RCVS guidelines, veterinary nurses must ensure that all observations are accurately documented, as failure to report significant changes could compromise patient care and legal compliance with the Animal Welfare Act 2006. A dog has suffered a compound fracture of the femur following an accident. Describe the steps for initial fracture stabilization, monitoring for complications, and post-operative care. Discuss the principles of pain management and rehabilitation during recovery, including the role of nursing staff. Answer: the first step in fracture stabilization involves controlling bleeding, providing pain relief, using opioids and NSAIDs, and immobilizing the limb to prevent further injury. A splint or bandage can be applied temporarily until surgical intervention is performed to realign and stabilize the fracture. After surgery, post-operative care includes maintaining pain management, monitoring for signs of infection at the surgical site, and preventing weight bearing on the limb through the use of a sling or special bandage. Nurses should assist with rehabilitation exercises as prescribed by the veterinary surgeon to restore function and mobility. These exercises can include passive range of motion movements to prevent stiffness. The RCVS guidelines require that nursing staff work closely with the veterinary team to ensure the dog's pain is managed and recovery proceeds without complications. The Animal Welfare Act mandates the prevention of unnecessary pain and distress during the recovery period. A cat has been diagnosed with hypothyroidism. What are the clinical signs of this disorder, and what is the role of veterinary nurses in supporting the treatment plan, including monitoring and patient education? What should be considered in terms of nursing care during the administration of anti-thyroid medications? Answer: clinical signs of hypothyroidism in cats include weight loss despite increased appetite, hyperactivity, vomiting, and an unkempt coat. The treatment typically involves medication, e.g., methimazole, to inhibit thyroid hormone production, or radioactive iodine therapy, which targets the thyroid tissue. Nurses should monitor the cat for adverse reactions to medications, such as gastrointestinal upset or liver dysfunction. Regular blood tests are important to assess the cat's thyroid levels and ensure appropriate dosing. Nurses should also educate the owner about the importance of medication administration and follow-up care. The RCVS Code of Professional Conduct emphasizes the importance of client education and ensuring that owners are well informed about the treatment and its potential side effects. In administering anti-thyroid medications, nurses must adhere to safe medication protocols to prevent errors. A 6-year-old dog presents with vomiting and diarrhea. What diagnostic steps should be taken to determine the underlying cause, and what nursing interventions are appropriate for managing these symptoms? Discuss the role of veterinary nurses in dietary management and fluid therapy. Answer: diagnostic steps may include blood tests, fecal analysis, and imaging studies, X-rays or ultrasound to rule out infections, gastrointestinal obstruction, or toxins. Nurses should administer fluids intravenously or subcutaneously to prevent dehydration and monitor the animal's electrolytes. Additionally, the dog may require a special bland diet to manage gastrointestinal upset, and the nurse should monitor the response to dietary changes. Pain management may also be required if the animal shows signs of abdominal discomfort. The Animal Welfare Act 2006 stipulates that animals should not suffer from untreated gastrointestinal conditions, and veterinary nurses must act swiftly to alleviate discomfort and provide supportive care. Nurses should follow veterinary guidelines for diet and medication administration. A dog is presented with signs of respiratory distress, including labored breathing and cyanosis. What is the emergency nursing protocol for managing respiratory distress in this animal? Include considerations for oxygen therapy monitoring and further diagnostic tests. Answer: the emergency protocol involves immediately providing supplemental oxygen through a face mask or nasal cannula. The animal should be placed in a position that facilitates breathing, such as sitting or with the head elevated. Nurses should continuously monitor vital signs, including heart rate, respiratory rate, and oxygen saturation, using a pulse oximeter. Further diagnostic tests, such as chest X-rays or blood gas analysis, may be necessary to determine the underlying cause, e.g., heart failure, pneumonia, or asthma. The guidelines provided by the RCVS on emergency procedures emphasize timely intervention to stabilize respiratory function. The Animal Welfare Act 2006 requires that veterinary staff ensure that animals experiencing distress receive prompt and effective care. A dog is diagnosed with chronic kidney disease, CKD. How should the condition be managed, and what nursing care interventions are critical in supporting the dog's renal function? Discuss dietary restrictions, fluid therapy, and monitoring protocols. Answer: management of CKD includes dietary modifications, low protein, low phosphorus diet, and fluid therapy to maintain hydration. Nurses should monitor kidney function through blood tests, including urea and creatinine levels, and provide regular subcutaneous fluid therapy to prevent dehydration. Pain management and antihypertensive medications may also be part of the treatment plan. Nurses must closely monitor the dog's weight, appetite, and urine output, adjusting care protocols as needed. The RCVS guidelines recommend that nurses closely follow the veterinary surgeon's treatment plan to optimize renal health, while the Animal Welfare Act mandates that animals suffering from CKD receive appropriate care to reduce discomfort and slow disease progression. You're reviewing a radiograph of a dog with suspected hip dysplasia. Describe the key radiographic signs you would look for to support a diagnosis of hip dysplasia and explain the role of diagnostic imaging in confirming this condition. Answer: in the case of suspected hip dysplasia, the radiograph is used to evaluate the alignment and structure of the hip joint, particularly the femoral head and the acetabulum. Key signs include shallow acetabulum. The hip socket may appear less deep than normal, leading to instability, subluxation, partial displacement of the femoral head from the acetabulum. Osteoarthritis. Signs such as joint space narrowing, bone spurs, osteophytes, and sclerosis around the joint may indicate chronic changes due to dysplasia. Coxofemoral joint subluxation. This is a hallmark of hip dysplasia, often seen on radiographs as a space between the femoral head and the acetabulum. Diagnostic imaging, particularly radiographs, provides a non-invasive way to confirm the presence of hip dysplasia by assessing joint congruency and any osteoarthritis-related changes, which are not always palpable on clinical examination. A 4-year-old cat presents with lethargy and decreased appetite. The bloodwork shows elevated liver enzymes ALT and ALP, low albumin levels, and high bilirubin. What do these findings suggest, and what diagnostic steps should be taken next? Answer: the elevated liver enzymes ALT and ALP, along with high bilirubin levels, are suggestive of hepatic dysfunction, likely due to hepatic lipidosis, fatty liver disease, which is common in cats, especially those that have been anorexic for an extended period. Low albumin levels further indicate impaired liver function, as the liver is responsible for producing albumin. Next steps in diagnostics should include ultrasonography to assess the liver for evidence of fatty infiltration or any masses that may suggest neoplasia. Further blood work, specifically a bile acid test to assess liver function more thoroughly and rule out other conditions like cholangitis or liver cirrhosis. Liver biopsy, in cases where non-invasive methods do not provide a definitive diagnosis. These findings require prompt intervention, including addressing any nutritional issues, e.g., initiating feeding in a way that prevents refeeding syndrome and managing the underlying hepatic condition. A rabbit is presented with a suspected gastrointestinal obstruction. Biopsy results show the presence of multinucleated giant cells and granulomas in the intestinal mucosa. What are the potential causes of these findings, and how would you proceed with diagnosis and treatment? Answer: the presence of multinucleated giant cells and granulomas suggests chronic inflammation, likely due to an infectious or inflammatory condition. In rabbits, potential causes include coccidiosis, caused by Armyria parasites leading to gastrointestinal damage and granuloma formation. Mycobacteriosis. Mycobacterial infections such as Mycobacterium avium can also cause granulomatous inflammation in the gastrointestinal tract. Foreign body reaction. If a foreign body is present in the gut, it can lead to chronic inflammation and granuloma formation. To proceed, fecal analysis for detection of parasitic infections like coccidia. PCR or culture for detecting mycobacterial infections, abdominal radiograph, ultrasonography to check for any foreign bodies causing obstruction. Treatment based on the specific etiology, such as antiparasitic treatments for coccidiosis, antibiotics for mycobacteria, or surgical intervention for foreign body removal. Mr. Stevens has a 6-year-old dog named Max who has been scratching excessively and has developed patches of hair loss and skin sores. A skin scraping test is positive for Demodex mites. What is the likely diagnosis, and how should Mr. Stevens proceed with the treatment and management of Max's condition? Answer: Max is most likely suffering from demodicosis, which is caused by the overgrowth of Demodex mites, a normal skin inhabitant in dogs that can proliferate under certain conditions, especially in immunocompromised or genetically predisposed dogs. Management steps: confirm the diagnosis. Skin scraping was positive for Demodex, so the condition is confirmed. Additional tests, such as a bacterial culture, may be needed to rule out secondary infections. Treatment. Treatment typically involves systemic therapy with ivermectin or milbemycin oxime, both of which target the mites. Topical treatments like moxidectin may also be used in conjunction. Supportive care. Treat any secondary bacterial infections with appropriate antibiotics. Monitoring. Regular follow-up is essential to ensure the condition resolves. If Max's immune system is compromised, e.g., due to concurrent disease, further immunosuppressive therapy may be required. Demonicosis is generally treatable, but in severe cases, long-term management and monitoring are crucial. What are the critical factors to consider when formulating a commercial dog food, and how do these factors influence the nutritional balance of the final product? Answer: formulating commercial dog food requires careful consideration of several factors to ensure nutritional balance. Life stage. Nutritional needs vary between puppies, adult dogs, and senior dogs. Puppies require higher levels of protein and fat for growth, while senior dogs may require lower levels to prevent obesity. Breed size. Larger breeds have different metabolic rates and joint health concerns, which influence the formulation of their food. Health conditions. Special formulations may be necessary for dogs with conditions like renal failure, obesity, or gastrointestinal issues where nutrients like phosphorus, protein, and fat need to be adjusted. Nutrient balance. Ensuring the right balance of protein, fat, carbohydrates, vitamins, and minerals is crucial. Protein should come from high-quality sources, e.g., chicken, lamb, while fats should provide essential fatty acids. AAF/CO standards. All commercial dog foods must meet the nutritional guidelines set by the Association of American Feed Control Officials, (OFCO), which ensures that food contains adequate levels of essential nutrients. A 2-year-old Labrador Retriever is underweight and has a very high activity level. What dietary adjustments should you make to promote weight gain, and why? Answer: to promote weight gain in a highly active 2-year-old Labrador, the following adjustments should be made. Increase caloric intake. Choose a high-calorie food formulation, focusing on food rich in digestible proteins and fats. This ensures the dog receives enough energy to support both its activity level and weight gain. Frequent meals. Feed smaller meals multiple times throughout the day to increase the total calorie intake without overwhelming the dog's digestive system. High-protein, high-fat diet. Ensure the diet is rich in high-quality proteins such as chicken, turkey, and fish, and fats such as chicken fat or fish oil to support muscle growth and overall body mass. Healthy fats also support joint health, which is crucial for active dogs. Supplements. Consider adding omega-3 fatty acids or other joint supplements if there are concerns about joint health due to increased activity. These dietary adjustments ensure that the dog can gain weight healthily while maintaining its energy levels for activity. The kitten has been on an unbalanced homemade diet consisting mainly of fish and rice. It presents with poor coat quality, lethargy, and muscle weakness. What are the potential nutritional deficiencies causing these symptoms, and how would you correct them? Answer: The kitten's symptoms suggest potential protein deficiency, taurine deficiency, and vitamin E deficiency. Protein deficiency. A diet high in rice and fish but low in essential proteins could lead to muscle wasting and lethargy. Cats are obligate carnivores and require a high-protein diet to maintain muscle mass and energy levels. Taurine deficiency. Fish alone may not provide enough taurine, an essential amino acid for cats, leading to poor coat quality and muscle weakness. Vitamin E deficiency. The lack of variety in the diet may lead to vitamin E deficiency, resulting in poor coat quality and overall lethargy. To correct these deficiencies, switch to a balanced commercial kitten food that meets all nutritional requirements, including taurine, protein, and vitamins. Supplement with taurine if switching to a complete diet isn't immediately possible. Provide a varied diet that includes appropriate meat sources like chicken, lamb, and organ meats to ensure proper amino acid intake. What is the role of fecal egg count (FEC) in the management of gastrointestinal parasites in livestock, and how can this test influence the deworming protocol? Answer: the fecal egg count (FEC) test is used to determine the number of parasite eggs, e.g. from roundworms, tapeworms, or flukes in a fecal sample. This test is crucial in identifying parasite burden. High counts indicate heavy infestation, while low counts suggest a lighter load. Guiding deworming protocols (FEC) can help to determine whether deworming is necessary. For example, if an animal has a high egg count, it may require treatment with an anthelmintic. However, if the egg count is low, treatment may be deferred, reducing unnecessary medication use. Monitoring effectiveness of treatment. After deworming, repeat FEC can be used to assess whether the treatment was effective in reducing egg shedding. The FEC allows for more targeted, effective management of parasite infestations, ensuring that livestock receive treatment when needed, which is more cost-effective and reduces resistance development. How would you manage the nutrition of a dog diagnosed with chronic kidney disease, CKD, and why are dietary changes critical in this condition? Answer: in chronic kidney disease, CKD, dietary management is crucial to slow the progression of the disease and reduce kidney workload. Key principles include protein restriction. A low-protein diet reduces the kidney's workload as they are less required to filter excess nitrogen waste. However, protein should not be eliminated entirely, as it is essential for maintaining muscle mass and overall health. Phosphorus restriction. Elevated phosphorus levels can worsen CKD, so diets should be low in phosphorus to prevent mineral imbalances and help maintain bone health. Omega-3 fatty acids. These are beneficial in reducing inflammation and kidney damage, so diets with added omega-3s like fish oil are often recommended. Adequate hydration. To prevent dehydration, which can further impair kidney function, feeding moist food or offering water regularly is essential. A specialized renal diet, often formulated with low protein and phosphorus, high-quality ingredients, and added fatty acids, is crucial in managing CKD effectively. A dog presents with vomiting, lethargy, and abdominal pain. Blood tests reveal elevated liver enzymes and hypoglycemia. What is the most likely diagnosis, and how would you report these findings? Answer: the elevated liver enzymes and hypoglycemia suggest hepatic failure or hepatic encephalopathy, potentially caused by a liver shunt or acute liver failure. Liver shunt, portosystemic shunt, a condition where blood bypasses the liver, leading to toxin accumulation and hypoglycemia. Acute liver failure can result in metabolic disturbances like hypoglycemia due to impaired glucose production and elevated liver enzymes due to hepatocyte damage. In reporting these findings, the following steps are critical. Describe clinical signs: vomiting, lethargy, and abdominal pain. Outline laboratory findings: elevated liver enzymes, ALT, AST, ALP, and hypoglycemia. Recommend further diagnostics. Imaging, e.g. ultrasound to evaluate the liver for shunts or lesions, and possibly a liver biopsy for confirmation. Suggest treatment options. Supportive care for hepatic encephalopathy and glucose supplementation. Explain the mechanism of action of corticosteroids in the treatment of inflammation and describe their potential side effects. What precautions should be taken when administering corticosteroids to animals with pre-existing conditions? Answer: corticosteroids such as prednisone and dexamethasone act by mimicking the action of cortisol, a naturally occurring hormone produced by the adrenal glands. These drugs exert their anti-inflammatory effects by inhibiting phospholipase A, which reduces the production of arachidonic acid, a precursor to pro-inflammatory mediators like prostaglandins and leukotrienes. Side effects include immunosuppression, increased susceptibility to infections, gastrointestinal ulcers, increased thirst and urination, polyuria, and delayed wound healing. In animals with pre-existing conditions such as diabetes or kidney disease, corticosteroids should be used cautiously as they can exacerbate these conditions. Long-term use can lead to iatrogenic Cushing's disease, and dosage should be tapered to avoid adrenal insufficiency. Regulations governing the use of corticosteroids involve ensuring that the benefits outweigh the risks and administering the lowest effective dose for the shortest duration necessary. Veterinary surgeons should also closely monitor the animal for adverse effects, especially in vulnerable populations. Compare and contrast the advantages and disadvantages of intravenous, omen, and subcutaneous (SC) routes for drug administration in veterinary practice. In what situations would you recommend each route? Answer: intravenous Romano. This route allows for immediate drug absorption, providing rapid therapeutic effects. It is ideal for emergency situations or when precise control of drug levels is needed, such as in cases of severe dehydration, shock, or critical illnesses. IV administration also avoids the first-pass metabolism in the liver, ensuring maximum drug efficacy. However, it requires proper training and technique to avoid complications like phlebitis, air embolism, or incorrect dosing. Subcutaneous (SC). The SC route offers slower absorption, providing a more sustained effect. It is useful for administering vaccines, fluids, and long-acting drugs. The SC route is easier to perform and is less invasive compared to IV administration. However, it may not be appropriate for emergency situations or when rapid drug action is required. Additionally, large volumes of fluid administered subcutaneously can cause tissue irritation. Veterinary nurses must consider the animal's condition, urgency of treatment, and the nature of the drug when selecting the appropriate route. What are the regulatory controls on the prescribing and dispensing of controlled substances in veterinary medicine, and why is it crucial to comply with these regulations? Provide examples of controlled substances commonly used in veterinary practice. Answer: controlled substances in veterinary medicine are regulated under laws such as the Misuse of Drugs Act 1971 and the Animal Welfare Act 2006 in the UK. These substances are classified into three categories based on their potential for abuse and medical utility: Class A, Class B, and Class C. Veterinary nurses and practitioners must adhere to stringent guidelines regarding prescription, dispensing, and storage of controlled drugs. For example, all controlled drugs must be stored in a locked cabinet, and detailed records must be kept of the drugs dispensed or administered, including the amount, date, and patient details. Examples of controlled substances include opioids like morphine and fentanyl. Class A, sedatives like diazepam. Class B, and certain barbiturates. Class C. Non-compliance with these regulations could lead to legal consequences, loss of professional license, and harm to the patient. A veterinary nurse is preparing to administer an antibiotic to a dog already taking a non-steroidal anti-inflammatory drug, NSAID, for pain relief. What drug interactions should the nurse be concerned about, and what steps should be taken to minimize risks? Answer: when administering multiple drugs, potential interactions can alter the effectiveness or increase the toxicity of one or more substances. In this case, NSAIDs and antibiotics can interact in several ways. For example, some antibiotics, such as certain fluoroquinolones, may increase the risk of renal toxicity when given concurrently with NSAIDs due to their impact on renal function. NSAIDs, on the other hand, can inhibit prostaglandin synthesis, which could alter the blood flow to the kidneys and increase the nephrotoxic effects of the antibiotic. To minimize these risks, the veterinary nurse should assess kidney function before administering both drugs. Consider adjusting dosages or changing the antibiotic or NSAID if necessary. Monitor the dog for signs of kidney dysfunction, such as changes in urination, lethargy, or vomiting, and report any adverse effects to the veterinary surgeon immediately. The nurse should also educate the owner about the signs of side effects to watch for. Mrs. Jackson is a longtime client who brings her elderly cat, Mr. Whiskers, into the clinic for a routine checkup. The vet prescribes a corticosteroid for an inflammatory condition, but the nurse is concerned because the cat has a history of diabetes. What steps should the nurse take to ensure the safety of Mr. Whiskers when administering this medication? Answer: in this scenario, the nurse should first alert the veterinarian to the potential risks associated with administering corticosteroids to a diabetic animal. Corticosteroids can cause increased blood glucose levels, which may exacerbate diabetes or interfere with the control of the condition. Therefore, the following steps should be taken: consult the veterinarian to confirm the necessity of corticosteroids and discuss potential alternatives, e.g., non-steroidal anti-inflammatory drugs. Monitor blood glucose levels closely before, during, and after corticosteroid treatment, as they can elevate blood sugar. Educate the client on potential signs of hypoglycemia, such as excessive thirst, urination, and lethargy, and advise regular blood glucose monitoring at home. Ensure the correct dosage is used, as higher doses may cause more significant side effects in diabetic animals. Follow up to assess the cat's response to the treatment and adjust the management plan accordingly. What is the proper technique for blood collection in a dog, and what precautions should be taken to avoid contamination or improper handling of the sample? How does improper handling affect diagnostic results? Answer: the proper technique for blood collection involves the following steps. Select the appropriate vein, e.g. cephalic, jugular, or saphenous vein. Prepare the site by cleaning the area with an antiseptic to prevent contamination. Use the correct needle size, typically 2.2-2.5 gauge for dogs, and ensure that the needle is sterile. Collect the required volume of blood without causing excessive trauma to the vein. Place the sample in the correct collection tube, e.g. DTA for hematology or serum separator tube for chemistry tests. Improper handling, such as delaying sample transport, exposure to heat, or inadequate mixing, can result in hemolysis, destruction of red blood cells, which may alter the test results, especially in tests for liver enzymes or potassium levels. Samples should be transported promptly under appropriate conditions, ensuring accurate diagnostic outcomes. Discuss the role of pre-anesthetic medication in veterinary anesthesia protocols. What drugs are commonly used, and what are their effects on the animal's physiology? Answer: pre-anesthetic medications serve several purposes in veterinary anesthesia protocols, including reducing anxiety, providing analgesia, and minimizing the required dose of anesthetic agents. Common drugs include acepramycin, a tranquilizer, helps calm the animal and reduces the dosage of subsequent anesthetics. Atropine, an anticholinergic, is used to prevent bradycardia, low heart rate, and reduce salivation during anesthesia. Opioids, e.g. morphine or buprenorphine, provide preemptive analgesia, which reduces the need for additional pain management during surgery. These drugs may affect various physiological parameters such as heart rate, respiratory rate, and blood pressure. Monitoring is crucial to detect any adverse effects during anesthesia. What are the key steps in preparing an animal for surgery, and why is maintaining a sterile field so critical during this process? Answer: the key steps in preparing an animal for surgery include pre-surgical assessment. Ensure that the animal is healthy enough for surgery by reviewing medical history, performing a physical examination, and conducting any necessary blood tests. Fasting. Ensure the animal is fasted for the appropriate duration to reduce the risk of aspiration during anesthesia. Sterilization of the surgical site. Collect the hair. Clean the skin with antiseptic solutions and drape the animal to maintain a sterile field. Sterile draping of instruments and team members. All surgical instruments, gloves, and gowns should be sterile, and the surgical team should follow strict sterile protocols to avoid contamination. Maintaining a sterile field is essential to prevent infections at the surgical site, which can lead to complications such as wound dehiscence or systemic infections. It is important that all personnel involved adhere to aseptic techniques at all times. How do you perform a fecal flotation test, and what are the potential limitations of this method in diagnosing parasitic infections? Answer: to perform a fecal flotation test, collect a fresh fecal sample from the animal. Mix the feces with a flotation solution, e.g. zinc sulfate or sodium nitrate, in a test tube. Centrifuge the mixture to concentrate the eggs. Place a cover slip on the test tube, and after allowing it to sit for several minutes, examine the cover slip under a microscope for the presence of parasitic eggs. Limitations of the fecal flotation test include sensitivity. The test may not detect all types of parasitic infections, especially those with low egg production or if the sample is old. Specificity. The test may not differentiate between different types of parasitic eggs unless they are specifically identified. Egg viability. The test does not confirm whether the eggs are viable or infective. Explain the role of an electrocardiogram in monitoring an animal under anesthesia. What are the key parameters that should be observed, and how do they guide clinical decisions? Answer: the CG is a crucial monitoring tool used during anesthesia to assess the electrical activity of the heart and detect abnormalities such as arrhythmias, bradycardia, or tachycardia. Key parameters to observe include heart rate. A significantly low or high heart rate may indicate a need for adjustment of anesthetic drugs. Rhythm. Abnormal rhythms, such as ventricular arrhythmias, may require immediate intervention, such as the administration of antiarrhythmic drugs. P-wave, QRS complex, and T-wave. These components of the ECG waveform provide insight into atrial and ventricular function. Changes in these parameters may guide the clinician to adjust the depth of anesthesia, correct fluid imbalances, or administer specific medications to stabilize the animal.